Release of information is a process where personal health information is made accessible to an authorized requester as per federal, provincial, and hospital guidelines. Over the last 5 years, the demand for access to records has increased by 33%, which has motivated our team to innovate and streamline our existing process. The main barrier to the current process was the ability to release health information in a digital format. The information requested was compiled and printed onto paper or a USB stick. Patients would have to schedule time to come into the Release of Information office at CMH, make arrangements to drive to the hospital, pay for parking, to complete the consent form, provide identification, to make the payments to collect the records. All of these challenges inspired our team to fully transform into a digital environment. Our innovation was to determine how to provide patients with the records electronically with a paperless system.
The main motivation for this idea was to provide better accessibility of personal health information disclosures to our patients who have compromised mobility or health by the CMH staff. The goal was to help patients and caretakers reduce the cost incurred to access their health record, such as parking and loss of work time.
From a patient perspective, this process change will now save them a car ride to CMH. They do not need to park and pay for parking. They won't need to navigate through the hospital to locate the Release of Information office. More importantly, patients can now retrieve the records online at their own time, and appointments are not required.
Working with finance, a solution was developed to enable online payment and notification to release of information when the payment had been completed. Based on the feedback from patients, I would say the project has been successful. Early measures show that this new process is being successfully received by patients, legal organizations, police departments, and Workplace Safety Insurance Board to better serve our community. In developing this process, many changes were made in conjunction with the original idea. Now most records are prepared in digital format and delivered as such. The reduction of paper usage has gone from approximately 20,000 sheets per month to less than 1,000. We can now utilize a hybrid work model to increase flexibility for staff and increase joy in work. I was excited to participate and have my project selected for the Innovation Fund. It was a great opportunity to present an idea and be given the resources to follow through with it. I had the opportunity to connect with other departments such as IT, project management, and privacy and risk to bring this idea to life. This experience showed me how we can implement solutions with limited resources, and smaller changes can turn into bigger changes. I would also encourage other staff to submit to the Innovation Fund to voice their idea. I'm thankful to the Board of Directors for creating the Innovation Fund, as it's been a great experience to be part of a project that is forward-thinking and puts CMH in a better position to meet future technology needs as well as the needs of our patients and community.